All right, welcome everybody, and thank you for joining us for tonight's Loyola Connect Live. And I'm really excited to introduce you all to Ciana Creighton. And I'm just going to do a quick little bio and then turn things over to Ciana. So she is a 2017 graduate of Loyola, and she studied psychology and political science. So Ciana was also very active as a student. So some of you may be involved in some of the same thing she was, from being in Evergreen to singing in gospel choir, a lot of CCSJ service programs, study abroad ambassador, prospective student tours through admissions, Green and Gray Society. We could really go on and on. Ciana also served on the Board of Trustees for 2 years. After graduation, while she earned her Master's of Public Policy in Health Policy and Management from Johns Hopkins Bloomberg School. And her research there is focused on health disparities and inequalities and community-based public health. And Ciana has been serving in DC in the Mayor's Office of Policy since June of 2019 as an Associate Director. And we're really excited to welcome her back just a few years after graduation, and looking forward to Ciana sharing some of your career story so far, some of the things you've learned, and getting into some conversation later on with our students. So Ciana, welcome. I'll turn things over to you.
Thanks so much, Jim. I appreciate it. Good evening, everyone. Thank you for joining tonight. I'm really looking forward to sharing a little bit about my story. And even though I'm going to be starting off the conversation, I really hope that this will be a conversation both tonight and then continuing forward into the future as much as you would like to. So like Jim said, I currently serve as an associate director in the Mayor's Office of Policy. So that is the Bowser administration here in DC. So I'm not that far from Baltimore, but it is amazing how DC is so different in many ways from Baltimore, both in their own great respects. And prior to serving in the mayor's office, I do think it's helpful for me to speak a little bit about my time in Baltimore, just because I would not be in the position I am today if it wasn't for my time in Baltimore. And originally, I grew up in a small town in Connecticut, so did not know anything about this part of the country, and really picked Loyola based off of the psychology program that is at the school. It's one of the only schools that had a psychologist in every major area of psychology, and that really stood out to me. Obviously, that doesn't have to do with political science, but I think that's important because I went in and declared psychology really quickly my first year. And it wasn't until my junior year when I decided that I actually wanted to pivot towards the policy arena. And I graduated on time, even though I made that switch in my junior year. And I think as I was taking a lot of my psychology courses and also the core courses at Loyola, I was very quickly realizing that providing direct service wasn't necessarily my interest. I was really interested in why people didn't have access to those services, or why there's different quality in services based off of where people live. And as I was putting all those pieces together, I was thinking, I think systems is what I'm interested in, but as it relates to people and the lives that people live. And so when I studied abroad, I ended up taking a class at the University of Cape Town in South Africa, where I realized that I didn't have to give up all of my individual interests, but there was a way to blend it all. And I took a public administration class, and I still remember the lecture when the lecturer said that public administration is a combination of psychology, political science, anthropology, and basically all of my interests. And I still remember going outside and calling my mom after class and realizing that this is it. I don't have to feel like I have to pick between psychology and political science. There's a way to combine them all. And so I got back and decided to apply for an interdisciplinary major because I took a lot of psych courses by that time. I was a junior, and I had a great internship. A fellow person, well, I guess actually she's now retired, but somebody from the Career Service Center at Loyola actually alerted me of an internship in the governor's office. And I applied and got it. So I interned, and this was the summer in between my junior and senior year. So again, very much towards the end of my time at Loyola. And that internship really solidified the decision for me that I wanted to focus more on policy. And so I decided that I knew I was going to go to grad school at some point, and it didn't really make sense to delay it if I knew I was going to need to do it at some point. So I applied to grad school up and down the East Coast and also in the UK. And it came down between two schools, and I ended up going with Hopkins very much because of my time at Loyola. And as Jim mentioned before, I was very involved in CCSJ, and I felt like I took a lot of time to build relationships, and I didn't feel like it was the most advantageous thing to do to uproot if I knew that I'd ultimately want to serve in this area anyways. So all of that to say, all of my experiences along the way very much informed what I'm doing today. I can literally think of exact skills from my internships at Loyola that I use now. And of course, grad school is a huge part of that as well. And actually getting training more specific to policy analysis and focusing on health policy. But now today, all of that is really helpful because I am in the mayor's office. And so I'm going to try to stay away from jargon tonight, but if you ever have questions about anything, feel free to use the chat function or just kind of say a comment and I'll try to address it. But essentially that means that I am in the executive branch of the government, but not only am I in the executive branch because I'm in the mayor's office, there's a different level of responsibility that comes with that. And one of those things is that I am a political appointee. And so that means that I have to live in DC because it is really important to live among those who you're serving and live alongside them. That also means that there's other fun events that I get to do. So not this year because of the pandemic, of course, but in last year for the 4th of July parades, for example, I get to march with the mayor and all of our other festivals and parades like that. So it's both my day job, as we like to say, in the office and in City Hall, but a lot of the work is also getting plugged in really quickly in the community and going to those events. And we have giveaways and different things that we do like that. So it's not just doing the research and the policy, it's also making sure that you know the people that you're serving. And I think for me, we're not a state, at least not yet. And I think DC is really interesting because the mayor is effectively the head of state. And so it's kind of like local government, but it's also like state government. And so it's a really great blend, but also it's not the federal government, but our office is on Pennsylvania Ave. So you can't ignore the federal government, of course not, because it impacts our work, but also you literally hear motorcades or you hear protests all the time. It's very normal. And I think all of those things combined have made the past almost year and a half feel like it's been 5 years in a lot of great ways, because I felt like I was able to acclimate really quickly because I got to know the city both when I was at Loyola through doing spring break outreach, but then also for my former job when I was in grad school, I was in DC a lot as well. So it's been a really great past year and a half. It's also been a whirlwind because, of course, the pandemic has been almost about half of my time since I was appointed. And I think initially, no one really knew what was going on. However, I did go to the School of Public Health. And so with my epidemiology training, I remember very early on thinking this is going to end up being a lot bigger than we're probably anticipating. And formerly, I didn't know if I was ever going to use that specific epi training, and now it became very valuable in the past few months. And so some of my work has shifted in the sense of the pandemic. We just started returning to the office, but I was also asked to help with the reopen plan for the city. And so a lot of my work back in April and May was very much focused on working with the committee to make sure that we could come up with a plan for the city regarding our particular topic. And so the great thing about my job, I think, is that I knew that I was going to be doing policy work, but it also allows for me to interact with people on the Hill or advocates and different people. But I really love that I get to work on a bunch of different things at once. And I like a fast pace. I like getting to juggle different things, but still getting to utilize my training all while doing that. So I love it here. I can't believe it's only been a year and a half, like I said, because I feel like I've been here much longer. So I'm really looking forward to getting to chat with you all tonight.
Ciana, can I ask you a follow-up question on some of your journey through college? You mentioned these couple of great anecdotes about being in this lecture, I think while you were abroad, where you got that definition of public administration, and then the governor's office internship that kind of confirmed your interest. And I think about how, I think for a lot of us through our lives, our career paths, we have these these aha moments that come up, maybe not even when we were expecting them. But as you look back on those few years, what advice would you give for a student today in terms of how do you set yourself up um, to be in those moments that you may not exactly know where that little aha is going to come from, but like what advice would you give to somebody to give them a better chance of being in those places where that kind of discovery and those decision points can happen?
Sure. So I'm really fortunate in that I have a really great support system. My parents are wonderful. And I think I love the way that even when I bring ideas to them, they never tell me what to do. They just provide really great listening ears. And I oftentimes will come to the answer on my own. But I also had professors who played that role for me as well. And there is one psychology professor who's still there, Dr. Carlucci, who I took my first semester at Loyola, which this is going to age myself a little bit, but so that would have been fall of 2013, which is wild that it was that long ago. And I remember there was a natural disaster at some point, probably within my freshman year, somewhere else in the world. And I just remember going to her office in Beatty Hall. And I just remember her saying, I can very much tell that if you had a choice, you would love to be on the ground over there. And I said, absolutely. I wish I could. I just want to figure out what I can do in lieu of not being able to be over there. Fast forward with Dr. Carlucci, I ended up doing independent research with her and other things. But I remember when I went to tell her, I felt like when I decided I was going to do an interdisciplinary major, that my psych professors who I really got to know, I wanted to let them know that I was probably not going to be taking as many psychology courses. And when I told her, she wasn't surprised at all. And she said, I knew that you were going to do that. I just wanted to see you arrive at that decision on your own. And I think that's telling because I always knew that I was really interested in service, but I was just trying to figure out for me what that best opportunity might be to actually do that. So I thought that maybe going into counseling was going to be that, but I realized kind of what I said earlier, that I was really interested in the systems and access and other issues instead of actually delivering that service myself. And I also have a pew in the chapel at the very back on the right-hand side that for basically all of those decisions that you just mentioned, Jim, I would go and just pray and kind of discern my way through. So I'd always go to that same spot and kind of just think before I would actually move forward with a decision.
Yeah, so it sounds like there's an intentionality around the framework, the community around you that you've fostered and stayed connected to, as well as even just that environmental. I love that idea of having that one pew that you'd go to as kind of a habitual thing for those kinds of decisions. It's really, really neat. One other thing I'm curious about, you mentioned you love being involved in lots of different things. You love the fast-paced environment. All right, so from March 2020 onward, I'd love if you could give us a little taste of exactly how that's changed, probably increased, how you have adapted to just all the challenges of 2020 that might be inspirational for us as we listen in.
Sure. I think being intentional is really important. I think also it's really important to keep in mind that when there's something like a pandemic that is so unprecedented, that everybody else also has a lot of questions that you might be having at the same time. So I think also extending grace to other people as everyone is trying to figure it out. But regarding the pace, it was a little different in the sense of I wasn't physically in the office. I have been fortunate enough that we have been able to telework and they've really prioritized our health throughout all of this. But it was hectic in a different way because there were press conferences all the time, or I was peeling my eyes to data because I wanted to see how community spread was happening. But I still had other projects that I was doing at the same time. And so I think even though I wasn't physically in the office, I was still working throughout all of that. And particularly during the reopen DC process, because we had a very tight timeline, but you need to still do a really thorough and a really great job. That meant I had to establish relationships and rapport because we had a lot of community input during that time. And I just think I work best from a place of relationship. And so how do you create those relationships when people just got appointed to work on a committee, but you have a report due? So you need to kind of figure out how to do all of that fairly quickly. but still be effective and efficient with your work and produce a good product. And so I think I was able to learn all of that. But then once that kind of slowed down, then if there are other responsibilities like volunteering at testing sites or things of that nature, being able to jump in those capacities while also still paying attention to what's happening in the research or any other important things that are happening.
Yeah, I love that perspective that, this is such an unprecedented situation that everybody has questions, everybody's trying to figure it out. And it sounds like part of your commitment has been giving folks grace to do that, but also staying committed to figuring out all the different ways that you can contribute. And it looks a lot different, I think, for all of us, probably, in terms of how we're contributing, whether it's through our jobs or even as students in different group projects, in our communities, in our homes. Contributing looks different, but we've got to be flexible and try to figure out how to do that the best we can. It's great perspective. Well, Ciana, I really want to thank you for sharing this little bit of your journey from through school and through then after with your master's and some of your time in Baltimore as well as your time in DC. It's been really fascinating and great perspective and important work. So we really thank you for taking the time to share it with us tonight.
My pleasure. Thanks so much for having me.